Good evening and welcome to Doctors on Call. Tonight we're talking about eye problems like cataracts, glaucoma, and macular degeneration. I'm Dr. Ruth Westra from the Department of Family Medicine and Community Health at the University of Minnesota Medical School Duluth, and I'm your host this evening. We'll be happy to take your questions about eye problems you're dealing with. Just give us a call locally at 218-788-2844 or toll free at 1-877-307-8762. I'm pleased to welcome tonight's panelists, Dr. Charlie Ahrens, an ophthalmologist with St. Luke's Hibbing Family Medicine Clinic, Dr. Joseph Morehouse, an ophthalmologist with Essentia Health Duluth Clinic, and Dr. Kevin Tracy, an ophthalmologist with St. Luke's Ophthalmology Associates. Our medical students answering phones tonight are Hannah Dissinger from Appleton, Minnesota, Brianna Engelson from Duluth, and Jesse Norman of Boxford, Minnesota. And now on to tonight's program on eye problems. So Dr. Tracy, you brought a wonderful model in. Do you want to walk us through the structures of the eye?
That's a good starting point, I think. Helps to understand the normal anatomy and working of the eye before moving on to other problems. So I think it's best to think about the eye as being a camera, and the idea is to try to give a good sharp picture to the retina that passes it on to the brain. So the front of the eye has a clear window called the cornea. That's one of the focusing elements. And then the colored part, the iris, covers up a clear lens that is also used to focus light onto a sharp point on the retina. And then electrical signals are sent from the retina to the brain across the optic nerve. And all those parts need to be functioning well for people to enjoy good vision.
So Dr. Morehouse, talk to us a little bit about cataracts, because I'm sure questions are going to come in about that. What is a cataract?
The cataract is basically a cloudiness of the lens. As Dr. Tracy pointed out, the lens sits right behind the iris, and when the lens gets cloudy, that's a cataract.
And what do we do if we develop a cataract?
Well, typically in the early stages when there aren't any symptoms, we just watch them and admire them. When it becomes an issue visually, especially if it begins to affect someone's ability to carry out their activities of daily living, then we do cataract surgery, which basically means to remove the cloudy lens and then we replace the lens, the focusing power of that lens, with a man-made clear plastic lens.
Oh, thank you. So Dr. Ahrens, we're going to talk about a couple big topics to get kind of things started, but talk about macular degeneration.
Well, macular degeneration is a disease of the retina, which, like Dr. Tracy said, is on the back wall of the eye, kind of in this area here. That's the entire retina right there. And macular degeneration is a very slowly progressive disease where the retina cells start to degenerate over time. There's two main forms, dry macular degeneration and wet macular degeneration. The dry form probably affects about 90% of the patients with macular degeneration and is probably about 10% of the problems that patients will see. The wet form is the opposite. It's about 10% of the patients, but about 90% of the problems. With wet macular degeneration, instead of just that slowly progressive dying off of the retina cells, we see more acute things like active bleeding in the retina, scarring, fibrosis, things like that, which can be very detrimental to the vision.
How about if we talk a little bit about glaucoma to start with too, Dr. Tracy?
Well,
describe what it is.
That sort of handles the big three. Cataract, macular degeneration, and glaucoma are all major problems, and as our baby boomers get older, it's going to become a bigger issue from a public health standpoint. Glaucoma is called the silent thief because what happens there is usually it's related to high pressure, but not always. It can be normal pressures. But the eye itself cannot tolerate what the pressure is, we think, and that causes damage to the nerve that goes back to the brain. So you start life with about 1.2 million nerve fibers, and over time you can lose quite a bit of those before you're aware that you have glaucoma. And if you just wait until it affects your vision, there can be so much damage that you are going to be quite limited. So the idea is, as people get older, to have periodic eye exams, to watch the pressure, to watch the nerve, and decide if people need treatment. And right now that usually involves trying to lower the pressure.
Most helpful. So Dr. Morehouse, If you have diabetes, why should you see an eye doc?
One of the manifestations of diabetes, or the complications of diabetes, is an entity called diabetic retinopathy. Diabetes can be thought of in its effects on the body as a disease of the blood vessels, and in diabetic retinopathy, abnormal blood vessels grow, and if left unchecked can steal vision. There are very effective treatments and ways for us to intervene to prevent the vision loss. But like Dr. Tracy mentioned about glaucoma, diabetic retinopathy can be a silent disease until late in the game, and if one waits until they've lost vision, then sometimes it's too late to bring the vision back, whereas we can prevent vision loss many times by catching it early.
Most helpful. So Dr. Ahrens, a caller from Butternut asking about, they have RP, but I think retinitis pigmentosa.
Mm-hmm.
Any new treatments for that?
Retinitis pigmentosa is, we think is, well, we know is genetically linked. There, from the standpoint of virus vectors and things like that, there's constant studies that are going on with it. Maybe the other panelists can chime in too, but I don't know of anything specifically that's been a large breakthrough as far as the stopping the disease in its track or improving vision for those patients who already have pretty deleterious effects from it. Do you guys know of anything real new coming out?
I would say the buzz right now might be these retinal implants, where basically electrodes are connected from the eye to the visual portions of the brain to allow people with advanced retinitis pigmentosa to at least detect motion, light and dark, but the quality of vision, the learning process is very complicated, so we're still a long ways away from having a good solution.
Yeah, that's a pretty rudimentary solution. I think that chip, has about 16 pixels. So those that know about pixels and computer monitors know that that's not very detailed vision, but it's something for some people.
Mm-hmm. Oh, very helpful. A caller, Dr. Tracy, asking about signs of getting cataracts. We talked a little bit about what it is. How would you pick up that potentially you might be getting a cataract?
Well, if we think of cataract symptoms, typically the most common is probably struggling more with reading, seeing road signs, so blurred vision. But oftentimes they may have good central vision and still be bothered quite a bit with glare. So we find nighttime driving, oncoming headlights may be the first sign. And I'd say it's very rare for it to be associated with any pain or redness, so it's going to be some sort of visual compromise.
Dr. Ahrens, a question from a caller asking about night vision, and as you get older you seem to lose and have harder times driving at night. Can you talk about that a little bit?
Well, part of it is already what Dr. Tracy was just alluding to, is everyone develops cataract. I tell all my patients cataracts are like taxes and birthdays. Everyone gets them, they only get worse. And so, as we age, as the cataracts, increase, as, like Dr. Morehouse was talking about, the lens gets more and more cloudy. That's going to start to diffract light more and more. And in dark situations, the more we need more and more light to see. So in those dark situations, the less light that's getting through because of the cataract, the less we're able to see. On the same side, as we age, the retina is also aging. So you can think of macular degeneration as a ramped up aging of the retina, but we're still all aging as we go along, and so those retina cells are not taking in that stimulus as actively as, say, when we were 20 or something like that. And so the combination of those two things, along with how the optic nerve functioning, all plays a role in night vision and needing more light to see.
Dr. Morehouse, a caller from the Iron Range, asking about floaters. Is there anything you can do about floaters?
There is a couple of things. The answer to that used to be generally no, but there are a couple ways to treat it. The floaters are basically opacities that occur in the clear jelly that lives in the back of the eye, which we call the vitreous, and they're a common symptom with aging. Most of the time when floaters come on, we encourage people to kind of wait, and many times they'll kind of sink out of the way, and so they're not as bothersome. But if they do remain bothersome, there's now a laser that can be done to kind of influence the floaters to move out of the way. And then ultimately, if that doesn't work, there's also vitrectomy surgery, which is a little bit of I usually use the term big surgery for a relatively small problem. It's not a small surgery to go through, but ultimately there are people that have vitrectomies for that condition as well.
Yeah, thank you. Dr. Tracy, we're back on glaucoma again here. A caller from Superior asking about eye drops to control glaucoma. Maybe a little conversation about medications for that.
Well, I would say it depends on the setting. In certain countries, obtaining eye drops and complying with eye drops is so difficult that people go right to surgery. But in the United States, that drops are usually the initial form of treatment. And some people, many people, get by with one bottle, maybe one drop once a day. Others will need 2 or 3 bottles, and if that's not controlling it, then we can start thinking about things like laser or even more invasive surgery.
Dr. Ahrens asking again about macular degeneration. We got the big topic, so now we're going to get lots of questions. Vitamins and use of vitamins for that, does it help?
The original study was the age-related eye disease study, which was one of the landmark studies in ophthalmology, and what that showed was that patients who had a certain degree of dry macular degeneration, by taking a certain formulation based on this study, had a decrease of progression from dry macular degeneration to wet macular degeneration by about 25%, and had a decrease in significant vision loss by about 19%. And so I think we're all in agreement that yes, it is statistically significant, and yes, the vitamins for those specific patients are very beneficial. Usually what I tell my patients is that if you're going to do the supplements, do it based on the formulation from the studies, because that's what's proven. The other vitamin supplements out there aren't necessarily bad, aren't necessarily going to hurt you. It's just we can't tell you that this is what the studies showed to be beneficial.
Very helpful. Dr. Morehouse, caller from Chisholm asking about twitch in the eyelid. We probably all had that. When should you have that checked out?
Generally speaking, that's a benign condition. We call it eyelid myokymia. I suppose in most cases, if it's just a mild twitching that you feel, it's probably not a worrisome thing. If you get, there are other conditions that can cause, if you find yourself actually unable to open your eyelid, there are things called benign essential blepharospasm and hemifacial spasm that can maybe signal something more serious. And if you have those kind of symptoms, I would say it should be checked.
Okay. Dr. Tracy, a caller from Bovey asking about temporal arteritis and if it affects the eye.
That is a very good question about a very important condition. It's really one of our more frightening diseases that we really don't want to miss, because a person can lose vision in one eye, and if they come in and we don't find that's the problem, they can lose vision in the other eye within a few days. So the inflammation that can occur in the temporal arteries can also affect the arteries that feed the retina and the optic nerve. And so anyone having sudden vision loss, especially over the age of 50, should get in to be seen promptly, because if they have that condition, they will probably need a biopsy to prove it, and then probably start high-dose steroids to save vision. Sometimes reverse the vision loss in the first eye, but more importantly, to save the vision in the second eye.
Very helpful. Dr. Ahrens, a caller from Embarrass. There's actually 2 questions about dry eyes in older people. Eye drops, if they're not working, are there alternatives, or what do we use for that?
Dry eyes is a really, really common disorder up here, especially now during the fall and winter months when it gets colder and more and more arid. So my baseline treatment for most of my patients is I start them on artificial tears, make sure that they're drinking enough water, try to pull back on the caffeine. I know we love our coffee up here, but we try to pull back on the caffeine, increase the water intake. If those base things don't work, then usually my next step of treatment is to start talking about other options, such as punctal plugs, which are little plugs that we put in the drainage system in the eyelids. or there are medicated treatments like Restasis that we can use. If those options don't work, we can still go up the ladder even more. It gets a little bit more complex, but there's still always another ladder that we can, or another rung on the ladder that we can climb to try and get symptom relief.
Excellent. Dr. Morehouse, caller from Duluth, asking about Lasix. Just if you can explain what that is, just some general information.
So LASIK and its cousin PRK are refractive surgeries basically designed to focus the light on the retina. They basically, those two procedures involve reshaping the cornea and changing the refractive power of the cornea to replace spectacles and contact lenses.
So there's another follow-up to that from Duluth asking if females should wait to have children, or should wait to have Lasix till after they've had children.
It's probably not a bad idea because during pregnancy, many times one's refractive error ends up changing. And so, yeah, you could have LASIK and then have it change and then either have to have an enhancement or actually end up being overcorrected.
Thank you. Dr. Tracy, a caller from Grand Marais asking about eye stroke. And can you talk a little bit about that and how it would be treated if there is such a...
Well, stroke we usually consider to be a problem involving the circulation. Typically, blood flow into the eye, if it's interrupted, can cause severe vision loss. We call that an artery obstruction, and that can be due to different causes, but often it will be little clots traveling to the circulation that feeds the eye, the retina, coming either from the carotid artery or the heart. So basically, as I mentioned before, sudden vision loss, it might be arteritis, temporal arteritis, it might be an artery obstruction without inflammation, but there again, prompt evaluation could allow treatment that might reverse the vision loss.
Thank you. Dr. Ahrens, caller from Drummond, Wisconsin, asking about optical migraines. Can you explain that?
Well, optical migraines, or it has a bunch of different names, but what it is essentially is the aura, if you've heard of the auras before, a migraine headache, and a lot of patients will notice a bunch of different visual symptoms that usually will last for about 15 to 20 minutes, and then they'll resolve, and a lot of times patients will have headaches after that. Occasionally you don't have to have headache, which is usually what people will call the optical migraines. The symptoms can be anywhere from pulsating lights, kaleidoscope appearances in their vision. Some patients just lose parts of their vision, and especially right away, the first time they have their symptoms, it's really scary for patients. And so as long as those symptoms kind of build up and then they go away in about 15 to 20 minutes, usually that's all it is. But again, as Dr. Tracy's been saying, if you have any vision losses, any vision changes like that, we should probably take a look and make sure everything is still looking okay.
Dr. Morehouse, caller asking about with glaucoma, if it's dangerous to remove cataracts. Are there any?
In a certain percentage of patients with glaucoma, their pressure will actually go down if you remove their cataract. It's not high, maybe 30%. Sometimes it's necessary to remove a cataract in someone with glaucoma, although that's quite rare. Generally speaking, if someone has very advanced glaucoma that's requiring several medications or the pressure is poorly controlled, sometimes it can be a little bit dangerous to remove a cataract, just because sometimes the pressure shortly after the surgery can go up very high, and that can be dangerous to the nerve. But sometimes there are ways we can get around that as well.
Excellent. Dr. Tracy, kind of going back to our eye model again, when you do an eye exam on a patient in the office, what exactly are you looking for when you're doing a retinal view?
Well, there's actually 8 parts to a full eye examination, and 4 of them are more or less a neurologic examination to see how the innervation to the muscles and the pupil and whatnot are working. And then we move on to actually inspecting the eye, and that usually involves checking the pressure, looking at the front of the eye with magnification, looking for cataract signs that might lead to glaucoma. And then we do try to dilate and get a look at the back of the eye, not just the retina, but the optic nerve, to look for glaucoma, macular degeneration, or other problems.
Okay. I have a caller from Hibbing, Dr. Ahrens, and everyone can probably jump in on this one, about using medical marijuana for glaucoma. Maybe you could talk about that, because
That's a hot button
it's
question.
a hot button, yeah.
So medical marijuana is approved for glaucoma. Generally speaking, it's independent for everybody's practice. Personally, for me, I think that the medications that we have, medical marijuana does lower the pressure in the eye, so it is useful from that standpoint when we treat glaucoma. From my personal standpoint, the medications that we have do a better job at lowering the pressure, and they work over a longer period of time, meaning the large majority of our drops we only have to take once a day, twice a day, occasionally 3 times a day. Marijuana has a very short half-life, and so it's a much more increased frequency use with less efficacy. And so generally, I don't use it. I haven't used it. And so at this point, in my practice anyways, I'm not using it at all.
Any other comments?
I would agree with that. You need, in glaucoma to be effective, you need 24-hour pressure control. And it's just not practical to do that with marijuana. The duration of action of marijuana's pressure lowering is just a couple of hours, typically.
I heard a glaucoma specialist said the reason to prescribe marijuana for a patient that has glaucoma is because the patient wants to smoke marijuana. Now, that was said half in jest, but along the same lines that it's not really our treatment of choice for glaucoma. So.
Dr. Morehouse, a caller from Cloquet, asking about surgery for the eyelids. When would we do that, and for what reasons?
Well, there are quite a number of different surgeries you can have done on your eyelids. Probably the most common would be in the aging eye. It's very common to get excess skin that kind of droops over and affects the vision. We call that a blepharoplasty. Also, for various reasons, one can get a droopy eyelid where the edge of the eyelid goes down and interrupts the visual axis. We do surgery on eyelids to remove skin cancers. We do surgery on eyelids because the lids or the lashes might turn in and scratch the cornea, or on the other hand, the lids can get droopy enough so that the lids don't cover the eye adequately. So there are quite a number of conditions for which you can have eyelid surgery.
All right, thank you. We're getting lots of calls here, sorry guys. Mm-hmm. So Dr. Tracy Big Fork asking about a growth on the eye. What kinds of potential things could potentially grow on the cornea?
Well, yeah, if this growth is something the patient can see looking in the mirror, most likely if it stops at the edge of the clear part of the eye called the cornea, then we call that a pinguecula, and generally there can be little bumps along the edge of the cornea that don't require surgery. If it's a growth that actually, as you mentioned, goes onto the cornea, now it can start to get close enough to the center part of the visual axis that they should have surgery to remove it. So they're not as aggressive in our northern latitudes as they're closer to the equator, so we don't see as much surgery for that condition called pterygium, but there are people that need it.
Dr. Aaron's caller asking about pus in the morning in your eyes, or a mattering. Mm-hmm. Do you need to do anything about that?
Well, number one, it's pretty common. We see that quite frequently. The most common cause is blepharitis, which I see in probably 60 to 70% of my patients. And whether or not you need to do anything about it really is based on how symptomatic you are and how problematic it is for you. If it's getting to the point where it's bothersome in your life, come in, we'll take a look, and we can kind of go down those avenues of what we can do to treat it.
Is there anything now that we're starting to see this season, Dr. Morehouse, for conjunctivitis or quote-unquote pink eye that we can do to help prevent that?
Well, pink eye is very much like a cold, and the majority of it that you see, especially when it's transmitted or when you see large numbers of people with it, it's a virus typically, and it's transmitted the same way as a cold. So washing your hands a lot, not sharing drinking glasses, not sharing towels with those who might have it or with others in your family, those are probably the primary preventive things you would do.
Very good. Any last words of wisdom for getting eye checks done routinely?
do it.
At least once a year or so?
Depends on the age.
Depending on the age.
Yeah.
Anybody over 60 should probably have it at least every 2 years, and younger than that, a little bit less frequently, but probably not too much more than every 3 years or so, even in the 40s.
Good. Thank you very much. I want to thank our panelists, Dr. Charlie Ahrens, Dr. Joseph Morehouse, and Dr. Kevin Tracy, and our medical students, Hannah Dissinger, Brianna Engelson, and Jesse Norman. Please join Dr. Alan Johns for a program next week on upper GI problems. His panelists will be Dr. Thomas Malloy, Dr. Daniel McKee, and Dr. Tom Nelson. Thank you for watching. Good night.